Hey guys, this is Mark with National Senior Advisors. Welcome back to our Medicare 101 training. Today I'm going over the parts of Medicare versus the plans of Medicare. This is something that gets confused with clients many times because they are both letters. Medicare uses letters for their parts of Medicare, and they also use letters of the alphabet for their plans of Medicare for the supplement. So just going over the basics here. To start with the parts of Medicare, you have four parts. Those parts are parts A, B, C, and D. I keep these separate because parts A and B are your original Medicare. This is where you will have hospital coverage with Part A, and then with Part B, you're going to have your doctor coverage. With original Medicare, you will have 80% coverage with Parts A and B once you meet your deductibles for each hospital and doctor. Hospital is $1,316 per 60 days. Make a note of that. And then with doctor, you have a $183 deductible per calendar year. With the hospital, if you obviously were to go in January and you meet that full deductible of $1,316 and you go back to the hospital in August, you will have to meet that deductible again, being more than 60 days. When you go to see a doctor, you meet that $183 and a few visits. At that point, for the full calendar year, that is met and you don't have to meet that again. So just to understand the difference in the deductibles there and how you will meet them, when you can meet them, and at that point, that is original Medicare, and that's the deductibles that go along with it. For Part C of Medicare, this is what is called a Medicare Advantage Plan. This is where someone will transfer their benefits of original Medicare out to an insurance company. A lot of popular choices is United Healthcare. Aetna has plans that are Medicare Advantage plans, Cigna as well. And at that point, once you transfer those benefits out from original Medicare, you're transferring them to individual insurance companies like this, and you are sharing the cost with that insurance company on all your medical bills, and on some of those you will actually have prescription drug coverage as well. With a Medicare Advantage plan, you will have copays and you will have deductibles. With your deductibles and copays, these will apply to almost everything that you have done, and that will all total toward your max out of pocket. With a Medicare Advantage plan, your max out of pocket can range anywhere from $3,000 to $6,000 per calendar year. With these plans, if you have to go to the doctor more frequently or you come down with any type of chronic illness, the Medicare Advantage plan could be more costly at that point, especially if you have to go to the hospital for those said chronic illnesses or events that come up. This is a plan that was originally designed by Medicare as a last resort for someone who could not medically qualify for a supplement or could not financially pay for a Medicare supplement. So Medicare Advantage plans were created to help take care of those situations. They are now marketed more as a viable second option, but you need to understand what you're getting into with those Medicare Advantage plans, and at that point, what you will be paying. Part D of Medicare goes along with original Parts A and Part B. This is your prescription coverage with Medicare. This is where you'll get a prescription drug plan, also known as PDP, and they will help cover the cost when you go to the pharmacy to fill your prescriptions. You have to have a qualifying prescription drug plan Again, the Medicare Advantage plans will have some of those with them. With original Medicare, you have Parts A and B, you have your Medicare supplement, and then you will get a separate prescription drug plan to help cover those costs. With Part C, it is again a total package of essentially A and B and D all together into one, but your cost and along with your max out of pocket, you will have networks with these type plans in most situations, and network out of network. So with your Medicare Advantage plans, you just want to be aware of that, of what you're getting into again. As we were discussing with the original Parts of Medicare, and when someone gets a Medicare supplement, there are plan letters that are Medicare supplements that help take care of the 20%. So when you go and get a Medicare supplement, you will have plan letters to choose from. At that point, you have plans A, B, C, D, F, G, and N available in most states. Right now, the most popular are plans F, G, and N. So at that point, we'll do away with the rest, and we'll look just strictly at plans F, G, and N. Plan F is the most popular plan in most situations. It is the most comprehensive plan. Medicare takes care of 80%. At that point, it is then transferred to the Plan F for it to pick up your deductibles, which it will pay the Part A deductible of $1,316 every time. It will also pay the Part B deductible of $183. And at that point, it's also picking up any of the 20% where it's medically necessary at a doctor or hospital. So with a Plan F, the only thing you have to pay is your premium. I will warn you that with Plan F, it is a plan that is being discontinued by Medicare, and in the future, that will not be available to new enrollees. And the premiums for this are going to get extremely expensive. It's going to go up and up and up. The second option, which I think is the best option, is Plan G. It is going to pay your $1,316 deductible for hospital. It does not pay the Part B deductible, which is $183 per calendar year. It does pay the 20% for you, so between the two options, the only difference is that $183 that Plan G doesn't pay. You pay that yourself, but the difference in premium for a plan like this generally saves someone anywhere from $250 to $400 a year. So with that savings and premium, obviously they can pay that deductible and still be ahead at that point. The last plan that is still popular at this point is Plan N. It is designed for someone who is, we consider, extremely healthy. And at that point, you will have your copays to pay for some doctor's office visits. For a doctor's office visit, it can be up to $20. For ER visit, it can be up to $50 per visit when you are not admitted to the hospital. If you're admitted, that ER copay is not applicable. You will also have your $183 deductible that you have to pay for Part B. Plan N will take care of the $1,316 deductible for hospital. At that point, you also want to look at excess charges. This is where Medicare assignment comes into play. If a doctor does not accept Medicare assignment, they can charge an additional 15% on top of whatever Medicare allows. So for every $100, obviously, that Medicare allows, the doctor can charge 15% more. At that point, you're looking at the $115 total charge. Medicare takes care of 80% of that. Your Medicare Supplement Plan N will help take care of the 20%. And then you will be paying the $15 there that is on top for the excess charge. That is something just to be aware of. But again, Plan F, Plan G, and Plan N are still the most popular. Plan G right now is the plan that we suggest the most because, again, you don't have to worry about the premiums going up near as much as you will with Plan F. You don't have to worry about the excess charges and copays like you do with Plan N. And at that point, the only thing you're paying with a Plan G is your premium and that $183 Part B deductible. And at that point, with the premiums being much more stable than Plan F and not having to worry about the unknowns with the copays and excess charges of Plan N, it's a great middle-of-the-road plan that we suggest at that point. But these are the differences between the parts and the plans of Medicare. Again, at that point, you have your parts of Medicare that are parts A, B, C, and D. You have original Medicare. You have your Medicare Advantage. And then you also have your PDPs, your prescription drug plans. But this is something right here that you just want to write down. This is original Medicare. This is your Medicare Advantage. And this is your prescription drug plans. Keep them separate, understand the differences. If you have any questions, please let us know. We'll always be more than happy to help you out with the plans that are available in your area and also going over the parts of Medicare. You can give us a call at 1-866-541-0745. And we're available 8:30 to 5 Eastern Time. Give us a call. Let us know if you have any questions and appreciate your time.